My name is Dr. Francis Were, a Consultant Obstetrician Gynaecologist and also a lecturer at Kenyatta University. I'm actually partnering with Ponea Health in providing obstetrics and gynecological services within Nairobi. My work entails providing obstetrics and gynecological services to women, both walk-in and those who are corporate clients for different companies within Nairobi. I also visit various hospitals to attend to different cases in obstetrics and gynecology. Sexual wellness, as defined by WHO, is actually both physical, mental, social, and emotional wellness sexually, in the absence, not necessarily the absence of disease or any illness in a woman. It's important that couples get screened for STIs, because the presence of an STI in a relationship actually will affect the relationship adversely in terms of their well-being in the first place, and of course when it comes to treating the illnesses that they may have contracted as an STI, whether it is something like syphilis or gonorrhea, that can actually end up affecting the relationship and even breaking up the relationship, because it will actually point towards infidelity. Self-testing kits they are good in terms of preserving privacy, but in terms of accepting the outcomes, they can actually cause some emotional disturbance. Especially something like if you're doing a self-testing kit for HIV and somebody realizes that they're actually HIV positive and it's something they are not expecting, then that can actually break them. So we actually advise that they actually go for counseling, and if possible have these tests done in a facility where a counselor is available to be able to handle them in case they're emotionally disturbed or broken after a bad test result is given out. Infertility is the inability for a couple to get a child after 1 year of unprotected sexual intercourse without the use of any contraceptive. Yeah, so the causes of infertility we have both male factors and female factors. Male factors account for 50% of the factors that we find when investigating a couple for infertility. And among the male factors that are responsible for infertility include a low sperm count or absence of sperm count when seminalysis or the semen is examined in the laboratory. And what could be the possible cause of this absence of sperm in the semen is mainly probably factors that could affect the testes in terms of production of the sperm, or factors that can actually obstruct the vas deferens which conveys the sperm from the testes to the urethra and on into the birth canal during sexual intercourse. Female factors, among others, include both factors that can actually be affecting the ovaries, hormonal factors, or tubal factors, which account for almost 60% of the possible causes of infertility. Other causes can also be genetic causes or structural causes that may actually be affecting the birth canal, the uterus itself, and of course the fallopian tubes. The current available treatment for infertility depends on the actual cause that is detected upon investigation. If there are hormonal factors that are affecting infertility, then these ladies are usually given hormones or supplements to be able to rejuvenate their systems and be able to maybe ovulate and get pregnant. But in situations where probably we have structural defects, like a congenitally absent one horn of the uterus, or maybe a uterus that has got two horns, then surgery is indicated in that situation, and these two horns are unified so that the uterine cavity can be wide enough to be able to accommodate a baby. But in case of tubal factors that account for almost 60% of the cases of infertility in women, which result from infection, then surgery can be done and the tubes can be actually repaired and fertility may occur, but there's no guarantee, because once tubal surgery is done, the fertility rate may actually be about 50%. Yeah, before receiving any of these treatments, good history must be taken from the couple and proper investigation done before any of the treatments are undertaken. Now, depending on what kind of treatment one may opt to take, for instance, if a lady has a problem with the uterus that probably is genetically not well made, and maybe she has a uterus that has got 2 horns, then sometimes unifying the uterus may actually not work. You may end up having a cavity with scarring inside, and again that may affect fertility in one way or another. Tubal surgery again may actually not work at all, depending on the initial cause of the damage that probably happened to the tube. Thank you for watching us today. You may book my services through ponea.com. We look forward to seeing you sometime.
Best healthcare option in 3 steps. Search, compare, book on ponea.com. Ponea, your healthcare companion.